What I would say to people who are skeptical is our team at Cedars-Sinai is approaching this like any other science. We have funding from the National Institutes of Health. We do NIH-sponsored research, randomized controlled trials. I'm a scientist, and so I'm skeptical too of any new therapy. I'm Dr. Brennan Spiegel, and I'm Director of Health Services Research at Cedars-Sinai. Yeah, so I'm a gastroenterologist by training, so I'm interested in the intestinal tract and where food goes and that sort of thing. But I've known for a long time that the brain and the gut are connected to each other. We know, for example, that if you have stress or anxiety, that some people can get stomach aches. And that got me to thinking about mind-body medicine more broadly, not just in my field, in gastroenterology, but in general, in medicine. The idea that the mind and the body are connected to one another and that we can leverage that connection to improve human health. So that led us to some research at Cedars-Sinai focusing on the role of virtual reality, or VR. And VR is a technology that most people think of as a platform for gaming or entertainment, but we've learned that VR is much more than that. VR is actually a technology that can help leverage our mind-body connections. And that's what we've been doing here at Cedars-Sinai, is learning how can we use VR to help people not only with cancer, but all across medicine to improve their well-being and their quality of life. So VR has so many uses in medicine now. For one, it's being used for simulation to help doctors and clinicians, for example, learn anatomy more efficiently, more thoroughly, and in ways that doesn't require, for example, a whole cadaver to learn anatomy. It's being used to help simulate patient encounters so that doctors can learn how to engage with patients in an empathetic way, which may seem sort of ironic when you're in a computer learning how to be more empathetic. But the research is really profound and demonstrates that doctors can become more empathetic and can learn how to practice difficult conversations with patients in these VR simulations. But what I'm really interested in is using VR not just for simulation, but to actually help patients as a therapeutic, to help manage pain, to help manage anxiety, even depression, post-traumatic stress disorder, even high blood pressure, dementia, schizophrenia, the list goes on and on. And for our patients with cancer at Cedars-Sinai, we use virtual reality in many different ways to help, for example, bide time while undergoing chemotherapy, or to help manage existential anxiety that can occur when you're being treated for cancer, to help find non-drug ways to support the medical therapies that we provide at Cedars-Sinai and elsewhere in a way that thinks about the entire biopsychosocial well-being of a patient. So I saw a patient recently who had severe pain, abdominal pain. And since I'm a gastroenterologist, they called me in to see this patient. And we really couldn't figure out what was causing the pain. We did CT scans, we did endoscopy tests to look inside with cameras, we did blood tests, everything was negative, but she had significant pain. So I decided to try virtual reality, and I put her in a headset here in the hospital. She was underwater, swimming with dolphins, whereas moments before she had been in this hospital room in pain. And she was quiet for about 3 or 4 minutes when all of a sudden she started to cry. And I said, "Are you okay?" And she said, "Yeah, I am, but I think I now know why I have this pain." And I said, "Really? Tell me more." And she said, "I think it's because of my brother." I said, "Your brother? What do you mean?" She said, "My brother, he died of stomach cancer, and I feel like I'm going to die that way too." And I said, "But we've looked in your stomach, and you don't have cancer, thank goodness. We've seen with a camera you don't have cancer." And she said, I know. You guys keep telling me that, but I haven't been willing to accept it. But now these dolphins, they're telling me I need to move on with my life. I need to accept this and move on." And I sat there thinking, oh my God, like what just happened? And she said, "A year on the couch," this is her quote, "and I wouldn't have come to this conclusion, but there's something about being underwater with these dolphins that's changing the way I'm thinking about myself and my life." And that's just one of now thousands of examples. And we've treated over 3,000 people at Cedars-Sinai with virtual reality. And we learn from every patient what incredible depths there are to the mind-body connection. And this is not voodoo science. This is neuroscience. This is true science now. And VR is a technology that allows us to tap into that science to improve human health. So there are now over 5,000 studies about the use of virtual reality in healthcare. And I've recently published a book called VRX, which is a book that summarizes this entire field of medicine. And now the Food and Drug Administration, or the FDA, has been paying attention to this new field and has a name for it. The FDA calls it medical extended reality, or MXR. And the reason the FDA cares so much is because these studies are clearly demonstrating over and over again that there are reproducible benefits of VR. For example, for pain management, we did a study here at Cedars-Sinai in hospitalized patients. It was a randomized control trial where half the patients received virtual reality for pain management, and the other watched a two-dimensional screen with relaxation videos, which also is known to help. But what we showed was that the VR reduced pain considerably more, statistically more, and meaningfully, clinically meaningfully reduced pain compared to the two-dimensional screen. And it's not just here at Cedars-Sinai. There are now hundreds of studies and even meta-analyses of studies that reproduce this finding, particularly for pain, but now increasingly for anxiety, for depression, and for many other conditions. To properly take care of somebody with cancer, it requires a truly multidisciplinary approach. Of course, there's the oncologist, who's sort of the quarterback of the team. The oncologist determines what the cancer is, what stage it is, and how to treat it medically or using other approaches, whether it's surgery or radiation. But around that quarterback, there's a team of behavioral experts who can support mental well-being, of dietary experts who can support nutrition. And then there are doctors like our team who come in with new technologies, digital health technologies, that can help support the patient in the context of the treatment that they're receiving. So really, it's a full biopsychosocial view of the patient. So we've had an incredible interest and at some points even a demand for virtual reality here in the hospital. So we're really proud to announce that we're now establishing with the Cancer Center a new virtual reality clinic. This will be a clinic that can help support our patients both in the outpatient environment and those who are hospitalized in the inpatient environment. And this service is going to augment the traditional therapies that we have and provide specific VR treatments for individual patients so that we tailor the right treatment for the right patient at the right time. And none of this replaces the treatments that we have, but with them together, it augments the ability that we have to take care of patients in completely different ways that we really had never imagined before. Yeah, that's me there. That's actually coming out of my mouth. And VR is an emotionally evocative technology, and music is emotionally evocative too. So the Loop Station just gives me this ability to engage with music in a way I didn't even know I could. So it's a lot of fun.